I'm joined today by Dr. Anthony Fauci, Chief Medical Advisor to the White House and Director of the National Institute of Allergy and Infectious Disease. Along with us is Dr. Cameron Webb, Senior Policy Advisor to the White House on COVID-19 equity. Thank you both for taking the time today to answer some vaccine-related questions for our readers. I wanted to start off with some questions about fertility. That was one of the most common topics readers wanted us to ask you about. So do any of the COVID-19 vaccines currently available have any impact on fertility? And what would your advice be to women who are concerned about getting the vaccine because they are pregnant or trying to conceive?
Well, there is no evidence whatsoever that the vaccines have any impact on fertility. This is one of those disinformation issues that we often talk about. And that's the reason why we have to make sure people get the right information. There's not only no evidence that it happens, there's no biological reason to believe that it could even happen. So that's the first thing. The situation with pregnant women there are still trials going on to look at formally at the safety in pregnant women. But if you look at the now over 70,000 pregnancies that have occurred in people who are vaccinated, the data look like they are no obvious red flag signals. The CDC follows this closely. And right now, even though there's no formal recommendation that the American College of Obstetrics and Gynecology said that vaccines should not be withheld from pregnant women. The thing that's important that people need to realize that the effect of COVID-19 on pregnant women is quite severe, not only for the health of the woman, but for the ultimate outcome of the pregnancy. So if you're going to compare the potential risk of a vaccine with the real risk of a pregnant woman, then it's very, very clear why the American College of Obstetrics and Gynecology says you should not withhold vaccine from pregnant women.
And the next question, a few people wrote in asking, they had previous negative reactions to other vaccines. The Gardasil vaccine was one example. Should they be concerned about taking the COVID-19 vaccine if they've had previous reactions to other vaccines?
It depends on the kinds of reactions that they've had. So this is a conversation that should always start with your own provider, physician, nurse practitioner, whoever it may be. Have that conversation about your risk. We know that folks who've had severe anaphylactic reactions, these severe allergic reactions, those are the ones we've said, pay a little closer attention there, make sure that this is done in close consultation with a provider, take some extra time waiting after you've received the vaccine to make sure everything's okay, and do it in a safe environment. But I think that, by and large, for most folks, the conversation has been with their provider that they are appropriate to get vaccinated. So we think that for the great majority of folks that should be safe.
And someone had also asked about drug allergies and said they've been hesitant to get this vaccine and others because of an allergy to amoxicillin and penicillin. Should that be something that people should be worried about with the COVID-19 vaccine?
The answer is no. The only thing that it was mentioned by Dr. Webb is that if you've had a history of anaphylactic reactions, you want to be in a place that can treat it. But people who have allergies to foods, to drugs, to a variety of other things that you have allergies for, that is not a contraindication to get vaccinated. You still should get vaccinated.
And someone I had heard from said they had a relative who was hesitant to get vaccinated because they had read about a link to prion disease with the COVID-19 vaccines. Can you address that?
That's just another example of disinformation, which is, that happens. I mean, people hear things. It's written by someone who gets an anecdotal story about something, and then it gets propagated. And before you know it, it gets on the social media and people start saying, well, I saw that on social media. What does that mean? So if you see it on social media, there's nothing wrong with asking the question that the person that you just referred to did. But the answer is a very strong no. There's no connection whatsoever between vaccination and prion disease.
And one of the questions that was also raised, a few people said they were worried about having their being genetically modified by the vaccine was the term that was used. Is there any way an mRNA vaccine can lead to genetic modifications?
We're trying to decide who's going to answer that, but the answer is a big no from both of us. It's just mechanistically can happen. You know, when the RNA gets injected, it codes for the protein, the spike protein, and then it degrades very rapidly. And there's no molecular mechanism for the RNA to get into your DNA. It doesn't go that way. DNA makes RNA, okay? That's the point.
And so one of the other questions that we got a lot was about, people being scared to take the vaccine when we haven't had years and years of data. They want to know, why should they take it now when we don't have long-term data about the effect of these vaccines?
I think the urgency is that we've got a pandemic that we've lost too many lives here in the United States, right? Over 560,000 more folks are not here today because, in large part, because of this virus, because of this pandemic. And so that's the urgency. That's the reason why these vaccines receive this emergency use authorization. Is the reason why we feel like the benefit of these vaccines, it's so important. But keep in mind, it's not that these were rushed. It's not that there's a lack of information on their safety or their efficacy. Quite the opposite. In fact, they've been under a microscope since they were first, introduced. This is building on 2 decades worth of research, right? So it's not something that we just started working on at the beginning of this pandemic. Both that mRNA technology and the research on coronaviruses came together at a certain time at the beginning of this pandemic. And we accelerated the work to get to a vaccine sooner through significant federal investment to help make this possible, to have a shot of hope for us to use in communities all over the country. So it's not that they were rushed. It's not that they're not safe. You know, it's quite the opposite. But it's important for folks to know all that went into ensuring their safety before we recommended them to the American people.
And one other question that was raised from a reader had to do with the possibility of nanoparticles crossing the blood-brain barrier. Is that something that you can address? Is there any truth to that?
That's easy. No.
Another resounding no.
Yeah.
So we also got a lot of questions about vaccinations for children. When will vaccines be available for people under 16, and how do we know they will be safe in children?
Yeah. The vaccines for kids from 12 to 15 have already been tested by Pfizer, and they're shown to be safe and highly, highly efficacious. Right now, that company is trying to get that permission incorporated into their emergency use authorization. So it is likely that quite soon we'll be seeing kids from 12 to 15 getting vaccinated. A number of companies, as we're speaking now, are doing age de-escalation studies in children from 12 to 9 years old, 9 to 6 years old, 6 to 2 years old, and 6 months to 2 years. We anticipate by the time we get to the end of this calendar year, at the latest, the first quarter of 2022, that all children of all ages, 6 months and older, will be able to be vaccinated.
Yeah, but just a quick word on that notion of herd immunity, right? That idea, that concept that so many people are talking about. That's the idea of having enough folks who are protected in a community to protect others. And in herds, if you think in the wild, often they're protecting the younger individuals in that society. And so it's part of the reason why it's so important for adults who it is their turn to get vaccinated already to take that opportunity. That's part of the way that we're protecting the children all over this country who haven't had the opportunity to be vaccinated yet, is by adults stepping up to help slow and stop the spread of this pandemic across our nation.
And another question we got, is about the history of U.S. government experimentation on Black Americans and the legacy of racial discrimination within healthcare. Why should people of color trust these vaccines?
Well, I think it's absolutely right for people of color to ask those questions. That mistrust is rooted in some real experiences, the depth of those experiences. And folks often cite that public health service study on syphilis in Tuskegee that ended only in 1972. So this is the recent past. I think what's important for folks to do is to acknowledge the process that we've used here. There's been significant involvement of a range, very diverse populations in the studies to bring these vaccines to market. So we know that they're effective across demographics. And also, I mean, even some of the scientists, really at the center of developing these vaccines are persons of color. You think of Dr. Kizzmekia Corbett. So there are so many reasons why this is a different moment. And yes, that mistrust is real and it's rooted in something. But what we can say sure is that these vaccines aren't born of that kind of egregious research, that kind of disregard for human life and well-being. Quite the opposite. And communities of color have been the hardest hit by this pandemic all over this country. And so in this instance, this is a vaccine that helps to reverse inequities rather than create them.
And data that had been released by the Tennessee Department of Health earlier this month showed that within Tennessee, the highest levels of expressed vaccine hesitancy have been among white residents in rural areas who identify as more politically conservative. What would be your message to them about why it's important to get vaccinated?
Yeah, I mean, we can both weigh in on this. It's, it isn't necessarily what your ideological stance is, Republican, Democrat, conservative, evangelical. It really is each individual needs to be able to get, as Dr. Webb says all the time, a trusted person that they can deal with and ask them what their opinion is, rather necessarily to listening to either myself or Dr. Webb, but, finding out from your physician, your pharmacist, people who you trust, people who are trusted messengers, and get away from this idea of falling into one ideological group. That's not the reason why people make decisions about their health. They make decisions based on getting information from people they trust. Cameron, you want to?
Yeah, that's absolutely right. I think there's a lot of bad information that's gone out to a lot of communities since the beginning of this pandemic, and certainly since the beginning of the vaccination response. But what's important to note is that ask those questions of the people who are charged with taking care of you and taking care of your health. Ask those questions of your doctor. Ask those questions of your pharmacist, the people closest to you in that capacity, and they'll tell you what the science has told us. So these vaccines save lives. These vaccines prevent hospitalization. And these vaccines help get our country back to normal faster. And that should be, for a lot of people, that's enough. That's what they need to hear to be ready to say, yes, I'm ready to get vaccinated.